Good morning. Welcome to Dr. Sushila Nayar Memorial Young Public Health Leader Oration 1. I am very happy that Dr. Ravikant Singh, Founder Director, Doctors for You, will be awarded Dr. Sushila Nayar Memorial Young Public Health Leader Oration 1. I would like to introduce Dr. Sunila Garg. Dr. Sunila Garg will be chairperson for this oration. Dr. Sunila Garg is Director, Professor and Head, Department of Community Medicine at Maulana Azad Medical College, New Delhi. She is MD in Community Medicine from Mahatma Gandhi Institute of Medical Sciences, Sevagram. She is also advisor to Indian Council of Medical Research and member Task Force Department of Biotechnology, Government of India. She is a recipient of WHO Biennium Fellowship in 1992-93, Overseas Development Agency Fellowship of British High Commission in 1996, and a recipient of Double Helical Magazine Best Doctor Award in 2016. Welcome, ma'am, to this oration.
Thank you so much. And as now National President-elect of IAPSM, and on first I will be taking the charge of National President of IAPSM, it's indeed my proud pleasure to, first of all, congratulate the organizers. Now, Dr. Garg has become Dr. Garg, Dr. Nitin, Dr. Subodh, and all, and my colleagues, Dr. Sanjay Zorpe, Dr. Kadri, and all for organizing this. But first of all, lots of congratulations to you for winning this prestigious oration, which is named after my guide, Dr. Sushila Nayar. As I told you, it's almost 4 decades that, and this is the thing, the vision and the torch we have to carry forward. So lots of congratulations for this. And as we go ahead with the oration, I'm sure, the findings of your oration will inspire all, me, first of all, myself and all the people who will be attending. And I'm sure the dissemination of your oration will be doing far and wide so that, people learn lessons. And, everybody works in the field of public health, but few young leaders, they definitely, come forward, who are the real leaders, but they inspire others. So without wasting any time, we'll go for your oration. Thank you so much. And thank you, Chetna, for those humble words. And thank you, organizers, thank you, Ashwini, for being there.
Thank you, ma'am.
And Dr. Ashwini, Dr. Ashwini, you are also from here, no? He's Dr. Kalantri's son or?
Yes, ma'am. Ashwini is Kalantri's son.
That's what I'm telling. So thank you so much. So without wasting any time, we'll start the oration. And Dr. Ravikant, we are going to have you, please, or
okay.
Or how?
Okay. Are you able to see my slides, ma'am?
Yes, very nice and clear. Reimagining public health. It's a real vision of mine.
Great. So thank you so much, ma'am, and IAPSM for selecting me for this oration. And I'm so happy to know that, ma'am, you work with Sushila Nayar, ma'am. This is amazing to know this. But as Dr. Abhishek Raut suggested that this talk mainly focus on young professionals in public health below 40. So I have made my slide like that only, and probably in 3-4 minutes I will discuss about how I started and then what are the work I did so far, and why I think the public health is so important now, especially for the young professional in this field. So as many of you know that I am originally from Bihar, but I did my MBBS and MD PSM from KM Hospital, Mumbai. So I through All India PG All India seats. I got admission in 2000 as an MBBS student, and then in 2007 I joined MD PSM. One thing I must say that I joined PSM by my own choice. I was getting lots of other seat, but I decided no, I'll do PSM, and I do it from the KM only. And so I started with a passion to, and I was very much influenced by some of my faculty in PSM department. And in 2007 only, there was a big flooding in Mumbai, and there was huge shortage of blood and platelets, blood product. And I started my own organization, Doctors for You. And then after completing so during the first year of residency only, I started this organization. Then my guide suggested that Ravikant, you should focus on completing your MD also. So after completing my MD in 2010, I joined Doctors for You full time. I worked at Doctors for You for almost 10-11 years as a full time staff. And last year I joined Department of Atomic Energy, Tata Tata Memorial Cancer Hospital, and currently I'm posted at Muzaffarpur district of Bihar. It is one of the aspirational districts of Niti Aayog, and currently looking after construction of 100-bed cancer hospital in Bihar. So actually, my journey started with this disaster relief response, mainly with floods in Mumbai and floods in Bihar. Blood, like the promoting blood and blood product donation in Mumbai. So you can see I have organized one big platelet donation drive at Mumbai using all the resources of KEM. But the idea was just to create. Many people don't know that blood platelet you can donate every 15 days, so 24 times in a year, while blood only 4 times every 3 months you can donate. So this was simple information. So ये idea click किया कि many even doctors, medical students from KEM, they were not aware. So I made one poster and started this platelet donation drive, and it was very well covered by Times of India after 1 or 2 days. And then lots of people came, turned up for platelet donation, and within 1 month the number of platelet donor in KM hospital doubles up. So this has given me a click that if you have nice idea, you can do. Resources are not a like limitation, and many people came forward to support. And so it was going very well. Then my dean asked, "What is this Doctors for You? Is it registered organization?" So actually, I lied to him. I said, this is it is registered. Actually, it was not registered that time, and because he asked me, I have to register. And then the next year in 2008, there was a big flooding in Bihar, and I'm from Bihar. I was aware that the health system in Bihar is very poor, so I mobilized lots of my friend, colleague from 4 medical colleges of Mumbai, and responded to Bihar flood. Unfortunately, one of my junior, he was also from PSM department, Dr. Chandrakant Patil. He died during that relief work because of the lightning. And suddenly what happened that many people, they came back, like I came back with the Chandrakant body, and after 2 days rest, all also came back. So that was like little hurting for me. I thought कि चंद्रकांत एक तरह से he was शहीद, वो लोगों की सेवा करते हुए शहीद हुआ. And we have like official permission to work in Bihar for 15 days, and everybody turned up. So that time I decided, that was the turning point. I decided that whatever maybe PG delay ho to delay ho, but I will go and work for this vision of Chandrakant at least for 3-4 months. And I worked there, and for almost 5-6 months, and then to like we started responding to almost all disasters. And Currently, Doctors for You is a very well established organization. Our vision is health for all, and the mission is to provide equitable, efficient, and effective healthcare services, especially for the people who are at the bottom of the pyramid. Uh, mm, uh, in 2020, we are working in more than 18 states across India. Last year, during the COVID peak of the COVID, almost 1,200 staff were working under Doctors for You. Currently, also almost 600 staff are working. We have 35 projects, more than 36 partner. I also got opportunity to work not only in India but other countries also, mainly in Nepal earthquake, and then Rohingya crisis in Bangladesh. So currently, Doctors for You is working in under these three broad domains. The one is disaster relief and response, for which we are very famous, and the second word is public health and nutrition, and third is overall community. So initially, when I started at young time, we thought that the medicine or the multivitamin antibiotic is going to change the world. But as over and understand the system, then you realize that there are many things affecting the all the determinants of health, and that's why now we focus on overall community of development of the community, and apart from health, we also focus on nutrition and the other livelihood also. So these are the picture from Nepal earthquake. Then this is one picture from Kashmir, after Kashmir flood in 2015, 14-15, we responded, and we have constructed more than 538 toilets. This was one of the most important and satisfying project for me, because we all know public health, how important is this. We constructed these toilets for the fishermen communities of Jammu and Kashmir. In last year in the COVID, we were working in all these states. At one point of the time, we were services to more than 2,200 COVID patient in various states. In fact, in Delhi also, we have converted one full stadium into a COVID hospital. You can see these pictures. Actually, my work from 2007 8 till 2019 has given us a great form understanding, at least has built our capacity to manage pandemic like this, the COVID crisis we are facing. And I'm very thankful to my colleague, especially from the colleague from Maulana Azad and many other colleagues. We work together and manage. We ran almost 12 COVID hospital across India, and including this two in Delhi. We have converted banquet hall in front of LNJP hospital into COVID hospital. So we tried lots of innovative idea. In fact, in LNJP hospital, still till date, more than 100 nursing orderly others are working for the hospital, because we think that only these the COVID ho gaya, just these multivitamin, zinc, and azithromycin is fine. ऐसा नहीं है. Inside the hospital, lots of, for one doctor we need at least 5-6 support staff. So we are providing all these kind of services in Delhi and many other hospitals across India. So if you remember last year when the COVID started, everybody was talking about PPE, shortage of PPE kits. So we realized this, and we thought that it's very important to protect the health workers. So we started this campaign called Protect the Protector, and I'm very happy to say more than 8 crore worth rupees PPE we have distributed so far. One of the biggest beneficiaries are like AIIMS Delhi, Maulana Azad hospital, LNJP, and various like more than 100 government and private hospital. Apart from that, in Mumbai, we run 5 health center, basically primary, just basic immunization, ANC, general OPD, dental care services, and so far more than 30,000 children we have. Almost every month we immunize 400 to 500 children. We also promote the surgery in rural area. We conducted training of 8 district hospital doctors in Bihar on emergency, LSCS, and anesthesia, spinal anesthesia training. It was funded by Bill and Melinda Gates Foundation through Care India, and that has helped me to understand the complex, like in fact, one of the thing which I realized during this project, that for public health person, means anybody can if some clinician like surgeon or other clinical department, if they take public health, they can do even much better than all those who are just PSM, because sometimes I realize the technical understanding of this technical thing is also very crucial to decide lots of policy related issues. So that was one learning I have. Similarly, we did lots of capacity building training also in India and Nepal. Also, we trained the doctors to do the cesarean section, and in remote district of Nuwakot after the Nepal earthquake. So in last 2 years, I have constructed 2 hospital. In fact, the one for Doctors for You, its actual plan is 200 bed hospital. Currently, it's 550 bedded capacity. And on the right, you can see this field hospital type setup. In 6 months, I have constructed this 550 bed cancer hospital without using a single rupees of government money. All the thing, whatever you are seeing currently, it's mobilized through CSR and my contacts. Only manpower is supported by the government. So I'm able to do all these things is mainly because of my team, and whatever you want to do, the teamwork and is very important to keep the team together. The key learning, just last 2 slides. The I think for young professional, the work is more important than publication. पहले मेरे को भी लगता था that the publication, research, or so unless until you work, you can't be a good researcher or publication. वो छपाई करने के लिए you can do anything, but those who work on ground understand only those people can generate the new ideas and do the analysis part, writing part, उसे बहुत लोग मिल जाते हैं, but the critical thing is thinking and in idea that you have to do, and unless until you work on the ground, you will not get those idea. The second is leadership is very important, and the most important ingredient of leadership is integrity as well as intelligence. So whatever you do in life, or whether in a some institute or in academic setting, leadership is very crucial, and one person can bring the lots of change, whether in the PSM department or on the field. And the third is, लोग बोलते हैं there are no opportunity, but I would say there are lots of opportunity, and you just have to identify those. You don't have to go anywhere. You just have to identify. In fact, कल एक बंदे ने बहुत अच्छा एक ये बोला था हिंदी में, that अवसर की तलाश में वो कहीं दूर प्रयास करने की जरूरत नहीं है, because अवसर जो है वो चारों तरफ है. You just have to realize that. So I realized these opportunity, and somehow I used the one thing was common to do public good, using all the contact resources whatever generated so far, and awards recognition to milte hi rehte hain. We never apply for any award, but almost we have received lots of. I'm the first and only Indian to receive SAARC country award, which was actually decided by all these 8 SAARC nations. British Medical Journal also awarded us the best medical team in crisis zone category in 2011. Then Abul Kalam, Prime Minister, everybody has awarded us, and Nepal government has also given us this recognition for our Nepal relief work. This is the last slide. After all these years, what I realize, as I say, reimagining public health and public health is a nation. Actually, it's a service to the nations. Through public health is the only platform where you much beyond your just department and yeah. So the right now need is to find what I think the most brilliant students should take the PSM and public health. ऐसा नहीं होना चाहिए कि वो rank कम आया then I should take PSM. It's not like that. I think the public health currently need the most brightest intelligent people. Only then the public health in India can be improved. And actual crisis, if you ask me, ma'am, I would say is the leadership. We have all the resources, but unfortunately we are lacking a strong leadership with integrity and intelligence at top level. And this is one of the reason why our health system is still not up to the mark. Thank you, ma'am. Ma'am, we can't hear you.
Have we lost Sunila ma'am? She is here.
Sunila ma'am, we can't hear you.
Please make her a co-host. Yeah.
Ma'am, I think you would have received a request. Ma'am, I'm sending you a request to unmute yourself.
Yeah, I couldn't unmute myself. That's what I said. Unmute me. Yeah, so thank you, Dr. Ravikant. And I could agree with you no less that basically it's one is the leadership, second is the skill you yourself mentioned, and third important is that, and which cross cuts all, is that we have to be the brightest of bright to come forward and join this subject of community medicine. And oration is, I have always realized it is nothing but it is on the work which you have made over a period of time. And to everyone I'll always say that oration is something, what you do, whether it is ordinary, extraordinary, keep on projecting it over a period of time. And I'm really impressed by your work in the field of disaster nutrition and empowering the communities. Once you empower the communities, I think this is something most important. And why you touched my heart is I work for Maulana Azad Medical College, which is 2000 COVID-bedded hospital known as Loknayak Hospital, with which you are associated. And Dr. Suresh Kumar, who is a director, is also my student, and he was also in my faculty of HIV medicine. So I really feel something of my own, both from the MGMS front and both from Maulana Azad's front. So that is one thing which is very important. But another thing which I'll say, Dr. Ravikant, your work needs to be carried forward now to different health and wellness centers across the country so that every person will have a last mile delivery. So, it becomes so very important for the young leaders now who are attending this meeting to see that, we all benefit from the torch which is shown by Dr. Ravikant, and all of us, because I think age is just a number. You see, when I think about 40 years back, and now I feel that that means after doing my MD, I feel that this is something which is very, very important. But another thing, Dr. Ravikant, I will say, you see, the work is like a fragrance, which always, disseminates its fragrance. But we have to also how another person will know. You see, today I knew about your work because I had heard about you. Secondly, being in the field of public health. But you see, the youngsters will know your work once we disseminate this. If you have no time, we will facilitate this. There is Journal of Family Medicine, Primary Care. There is Journal of Preventive and Social Medicine. I'm very sure that you will get people to disseminate your work. And this is how you will create more and more leaders. Because you see, everyone, every time, when you look at, people find me because, madam, this is your work and this is what we want to have the reference. So similarly, I want to learn more about you, and our youngsters will learn more about you. Please disseminate, and we will find people who will write papers on your behalf. And if you have no time, so definitely, and I can say I'll connect you to Dr. Raman, who is a editor of Family Medicine Primary Care also. And he's also president of Family Physicians of India, because he's also doing a lot of good work. And we, as I as for coming president for IAPSM, will see that this oration is published along with all the works, which can be broken into different halves. Something like you talked of disaster management, something you talked of COVID care, something you talked of in sense of empowering women, antenatal. I was, really, that touched my heart when I came to Delhi. Because of my work experience in Wardha, I realized how important is maternal care, child care, people coming with tuberculosis. Till now, we have got goal of 2025, but we have got a long way to go. So I feel that it is so very important. But I will not take much of your time. I will ask some of the youngsters who want to ask some pressing questions. Please come forward, and I really congratulate you on your work. And I'm there always for you. I can promise you from this platform that I'm there as Dr. Sunila Garg. Please forget all the, professor or whatever it is. I'm there as Dr. Sunila Garg from MGMS Sevagram, who will definitely, whatever, because National Program for Prevention and Control of Deafness for Government of India, which has got 6.5% prevalence of moderate to severe hearing loss. I have written from scratch, which is in 595 districts of the country. So you see, it is because of our Sevagram, this thing, I'll say that, in my case, but definitely leaders are born everywhere, I'll say. And leaders will make super leaders. We have our, country lead in form of Modi ji. I could see you, he was appreciating my work, and Modi ji will not appreciate anybody's and everybody's work. Let me tell you that. I have known him from very close quarters, and work, and a meaningful work is very, very important. So, anybody has got any pressing questions for our young dynamic leader, that will be very, very important. And Dr. Subodh, you've got none better choice than Dr. Ravikant to choose. That is important. And I say that, we make very good choices in this. So you like to say some words, Dr. Subodh, and then we open it to others also. I'm sure there's going to be a little time left for this. 11:35, we've crossed the time, but still we'll take one or two questions. Yeah. Dr. Subodh, will you like to add something?
Ma'am, I think he had to leave. There was some COVID crisis in his family.
Okay.
So he had to leave. Yeah. I think on behalf of Subodh sir, I'll only say that Ravikant symbolizes what Sushila Nayar Behenji used to say. To serve humanity is nothing, there is no greater spirit than that. And I think his work exemplifies that. And whatever recognition that he is getting today is because of his service.
Any one pressing question from any of the, I can see Dr. Chandrakant is also here. Can he just come up and speak some words? And Dr. Chetna, will you like to add something because of a long journey at MGMS? So lots of congratulations. I'll say lots of congratulations and best wishes. And I wish you keep this. And I'm sure that in next year, I'm going to see at least 4 printouts from your exemplary work. I'll say simply awesome. So that's one thing which makes me very proud of your this thing. Program. And thank you, Abhishek, for having, Dr. Ravikant on this platform. And I wish him all the best. And I wish everybody, the organizers, all the best for this. Thank you.
Congratulations and thank you to all.
I'm sorry to interrupt, ma'am.
Yeah.
Ma'am, we have one question from Dr. Jitesh Kuvatada. With your kind permission, may I
Yeah, you can
ask you
ask.
the question? All right.
Yeah.
Ma'am, he says, doing a good work for communities and people, is joining or founding or working with NGOs the most suitable option? If not, how one can do this through whatever position he or she is in? Kindly elaborate with examples.
So
Dr. Ravikant.
yeah, so basically, there is no like good option or bad option. Like 2 years back, I was in NGO. Now I'm in a central government. So things like what I feel is when you start the career, at least for the first 3 to 5 year, we should not think about the salary or remuneration. We should think about the working with the people or the working on the ground or the person with who has like at least 15-20 years ahead and doing some amazing work. So the after MDPSM, at least everybody should spend at least 5 years on the ground and then decide the final thing. So whether you are in an NGO or the government, opportunities are everywhere. It's not that in the in fact, I got this opportunity and the post of Tata Memorial Cancer Hospital. As you know, TMC is a big brand, reputed. It was actually offered to me, and they said you have to join. So, and actually, it was just because of my work on ground. So, ultimately, wherever you are, whether in NGO or your work should be like that. That it should speak louder than the any thing other. And in fact, I also said when I did after MD, I joined with a salary of just 20,000 rupees per month. At that time, I was not thinking about I could have joined WHO or UNICEF or any for bigger packages. But I think working in these urban slums of Mankur is more important that time and to support my organization. So there is no perfect question you answer. You have to decide about this.
Thank you, Dr. Ravikant. I think you can unmute Dr. Subodh. He's here because I was seeing him moving, but I thought technology has made him moving. Yeah, Dr. Subodh, you can come. Yeah, please. Yeah.
I was here. Could not listen to Dr. Ravikant's talk, but I joined later when actually you were speaking. But I have heard about Dr. Ravikant's work from many people, and I understand that even when he was a PG student, from that time, he's doing good work. I was there during Kosi floods with a team at Saharsa district, and I heard that Dr. Ravikant was also there and his team was there doing rescue work. I did not get a privilege to meet you, Dr. Ravikant. I definitely want to meet you and know about your work more.
Definitely, sir.
And regarding
we'll meet at MAMC, Dr. Subodh. Now you have a chance to come to MAMC because of your better half. So, and he keeps coming, I believe, and then we will meet in my office. So let's see. And many people, we can make, a small gathering. And I promise that you will be having a good discussion with them. Thank you.
Regarding the Oration, it was a blinded review and his name was picked up. So if you do good work, it's not only academic, but groundwork, working for people is important. And your selection for the Oration definitely proves that. Congratulations. Actually, we are lucky to have you here. Thank you so much.
Yes, sir. Thank you, sir. Thank you.
Thank you. And it's real pleasure and honor to be, having a youngster. And I always say that it's, we all must create first the workers with dedication and then the leaders, and automatically things start moving forward. So thank you. And Abhishek, I have sent you one pager, this thing of mine also, which has a photo on one side and this thing,
Yes.
which you can use it for future, this thing also. Okay. So
Thank
if time permits, tomorrow I will come and talk to you during your deliberations, because today I'm a little busy with my, as I said, COVID has made everybody busy. After this, there are 3 works which are lined up, but I have got the links now and I'll be joining very soon. And during my presidentship also, I promise you all the help, whatever you will require. And let me tell you, MGMS is very close to my heart, because you cannot escape, but to have its place in your heart. So thank you so much. Thank you.
Thank you, ma'am. The pleasure was all ours to have you with us, and we look forward to your blessings and support.
Thank you. Thank you so much.